Good morning, good afternoon, good evening. As per the time zone, you are watching this video. And today we have here with us special panelists with us with international exposures. And we are going to have international panel discussions on experience of oral health professionals during COVID times. So let me briefly introduce our panelists with all the audiences. We have Professor Dr. Sanjay Saraf. He is a professor oral pathology from Oman Dental College, Oman, Muscat. And we have Professor Dr. Kawajit Singh Asi. He is the professor and head Department of Periodontology, Himachal Pradesh Government Dental College, GDC, and Hospitals, Shimla, Himachal Pradesh. We have Professor Dr. Pravesh Mehra ji. He is Director, Professor and Head in Oral and Maxillofacial Surgery Unit of Lady Hardinge Medical College, New Delhi, India. And we also have Professor Dr. Pankaj Goyal ji. He is still to join some technical issues. He is Professor of Public Health, Dentistry, and Head of the Department, AIMS Bhopal, and ex-principal RIMS Ranchi. So let us go one by one and listen to the views of our professional panelists and see how they dealt with their management and their protocols during COVID times. So let us start with Professor Pravesh Mehra ji. Professor Pravesh Mehra ji, the virtual mic is yours.
Thank you, Dr. Sumant. I think with my colleagues, Dr. Sanjay Saraf and Dr. Kawarji, it's a pleasure always to be with you, Sumit, with the initiative that you have taken, especially to get in all four of us. I remember our good times that we had at the dental wing of Malazad Medical College, or the maid was there. That must be around 20 years back when we were together. And from there, we have evolved about into each of our professional branches as specialists or as super specialized people in our branches. And Sumant, we congratulate you with your work there. We saw your work in Nepal, in India, and in Kuwait, of course, where you continue to live. God bless you with all the good work and the good babies that you take care about. Yes, regarding the pandemic part, there are 3-4 things that we had done at Lady Hardinge Medical College, Delhi. And I remember the lockdown that started in India was roughly in the end of March, 25th or 26th of March. That was 2020, so roughly around 2 years back, around 3-4 years back. And when that lockdown happened, we used to get phone calls on my mobile phone, especially of relations or patients known to, regarding some issues, especially could be dental issues or regarding maxillofacial issues there. Somebody having some pain, some swelling, some trismus there. So to basically continue providing treatment during the pandemic, it was a real challenge as around the world globally, which everybody, including Cover, stationed that he would agree, and Sanjay at Oman Dental College, and including the Kuwait times that you must have seen, Dr. Sumant. So these were really challenging times, and to get over this, there were 2-3 things that we did at Lady Hardinge Medical College, and especially when there was no protocols in place, there were no N95 masks, we didn't have any protocols, we didn't have any infrastructure regarding PEPs that were to be used for treatment of patients or to see patients. So initially, we from the IDA West Delhi branch organized a webinar where we try to get in protocols in place about practitioners. Okay, don't feel dejected with the virus around, because the news, you see, the news was very despairing one. It most connecting, like everybody's dying, which is happening over the world, and it is spreading like anything. So people were scared, and we tried to do that among our fellow colleagues in West Delhi and Delhi, or in India also, where we made protocols for them, how to open up your practices, what all to see, don't get scared about, getting connected to our practitioners, providing support to each one. So this was the number one thing that we did. The second thing we did, from including providing protocols in our place at the Department of Lady Hardinge Medical College. Secondly, what we did was, since the patients or the people could not visit hospitals or healthcare providers, So we wanted to provide to everyone a platform, and for that we got in a telemedicine. We started telemedicine, and we were lucky that during that time of the pandemic, only 25th or 26th of March, the government of India came out with guidelines regarding telemedicine, especially by the Board of Governors of the MCI, because the MCI was dissolved around 6 months back. So the Board of Governors of the MCI, including the Ministry of Health, came out with the telemedicine guidelines. And with these guidelines, we could start some teledentistry or telemedicine services for the hospital. And I took the initiative on part of the Department of Dental and Maxillofacial Surgery at Lady Harding, and we made a platform where we had simple mobile phone, simple WhatsApp, a centralized number where you could provide services to these patients. Mail ID also, if the patient sent a mail in there. Subsequently, we changed this type of a localized platform into a AI-enabled, that is an artificial intelligence-enabled platform to provide telemedicine services or teleconsultation. And now you would be happy to note that we have provided around 50,000 consultations to patients on telemedicine platform of the NIC, which we call it the Vadevani. And the other thing that we did was we were already providing a dental oral health helpline in the form of a seva called the MO Oral Health Seva or MO Health Seva. So MO means a mobile oral health seva or the Ministry of Health and Family Welfare Seva. So this was basically meant for dental and oral health, where it was again an AI-enabled platform which was used to provide these services. And I would like to share you the number with this that you could use it for your patients also. Now this is a helpline which IVR enabled. It is a 24/7/365 helpline, and it is free. It is toll free. So you don't pay any money if you're dialing from India. The number is very simple to remember. It is 1800 11 20 30. The meaning is very simple. 1800 is a toll-free number in India. 11 is a Delhi region number, and then 2032. जिसको हम बोलते हैं हिंदी में 2032. तो 32 तो adult के दांत होते हैं और 20 बच्चों के होते हैं. So last में 2032. That is why I took the number of 2032 to provide an awareness people that there are two sets of teeth of 20 and 32 maximum set of teeth in human beings. So that was again informative to the people, and you could dial this number up and provide us some feedback about your corresponding with this number. How has it helped you? So these are the 2-3 things that we did. Now, everything was not rosy here during this time of the pandemic, mind you. Every one of us might have suffered some relations or known to friends or very dear friends, and similarly, including me, somewhat of my relations, some fast friends. But one of the most close person of my friend who helped me develop this AI helpline, helped me devise this telemedicine platform, Lady Harding, we lost him to the pandemic. So that was again a very emotional thing to me of losing him during the pandemic. When I was positive and I could not help him during that time of the April-May 2021, when the second wave came. There were hardly any oxygen supplies in the hospital, and that is the time that we lost him. And I'm very emotional that we could help him in any way, getting a place in the hospital. Subsequently, we got him admitted there, and he was there for 2-3 weeks, but we could not save him from it. So these are points of learning also, and it was quite a challenge during these times that was there. So I think I would like to leave here. Sumant, you can go ahead with the Kavarjit around and Saraf, and if Pankaj has joined, I think my views are this only for the time to come. And we treated since with mucormycosis also. So that was again a challenge, but that is a separate story. So when we come down, we'll tell you about everything as one go, how we made protocols, what all protocols we made. I think all over the world this must be there, getting protocols in place, and each person would have some sort of protocols in there. So it was a real challenge to do that. Taking exams, getting people, PG students, give that exams online or some mode of communication there, not using any patients to do that. So these were really challenging times. Thank you, Sumant. Thank you. Thank you for an opportunity.
Thank you very much.
Let's hear Sanjay Saraf and come.
Thank you very much, Professor Pravesh Mehra ji, for your kind discourse and nice all those protocols you made and all those efforts you made during the challenging times, and now you are streamlined all that. We plan to be a model for that. Now we move on to our next panelist, Professor Dr. Kamarji sir, and I request him to take the virtual podium. And he is the professor and head of periodontist department, Government Dental College. So over to you.
Thank you, Sumant, for the kind words, and God bless you for what all you are doing at this forum and at the World Forum also, especially for the children who keep on posting. Anyways, coming straight away onto the topic, what Dr. Parvesh has already said, and it's always a pleasure to talk to old friends and reminiscing about old times. But nevertheless, what I would want to say is that in addition to being the head of the department, I am also the nodal officer for my institute by the government of Himachal Pradesh. Involved in this whole management of COVID protocol. As Dr. Pravesh rightly said, it was March 24th when the lockdown was placed in. But we being in a government hospital and emergency workers, we had to go to the office and were there, all the heads were there, and the junior staff was staggered. It gave us some time to actually formulate protocols, and by lockdown was seriously thought over, it became very imperative that dental treatment, medical and of course the dental treatment has to continue. It has to be given and it has to be provided in a effective and safe manner. Priority being the safety of the patient, as well as safety and health of the patient, as well as the safety and health of the dental care providers also. And as soon as we went deeper into the lockdown, we realized that dental treatment always requires a continuity. You can't just give dental treatment at a point of time. So you need to give it in a continuous manner, and lockdown and closing down of the OPDs was not a solution. And time we were proud to start the medical college, all the specialist OPDs of the dental college as well as the Indira Gandhi Medical College, which is our big brother medical college. So coming to the create an outline of the protocols with all the heads and all the faculty members which were there at our disposal. And the first point was, as Paresh said, was communication or telemedicine. So in India, we have an app which is the Sanjeevani app, which you all might be knowing. So it was the government provided us the Sanjeevani app, and we started within 3 weeks' time. I think we started on with the Sanjeevani telecommunication, and this was first point of
Dr. Kamarji, sorry, yeah, you're on now.
There was so much panic, but naturally the first thing was the telecommunication. So we set up a telecommunication center in the college only and provided 3 or 4 faculty members who by rotations were put on those duties. And they were all the patients initially were bombarded with the treatment related. But as I said, we started our OPDs in limited numbers. For the starting of that OPD, we had to develop a treatment plan or a protocol when the patient visits us. So for that, we provided, I'll just go through in a busy that as soon as the patient arrived at our institute, there were people in the triaging area or pre-triaging area.
Dr. Kamarji sir, I think you're mute. Yeah.
It's automatic. Sorry. Right. So once it was decided that the patient visibly healthy, he was let in and he was screened thermally. If the patient had fever, he was straight away referred to the flu OPD, which was in a medical college. And if the patient did not have any fever, he was allowed the entry into the triaging area. He was taking all the protocols. His consent and response were formed. Was a high risk patient, his treatment was deferred or he was recalled for the treatment. If it was a low risk patient, the patient was referred to the Department of Medicine and Radiology and Diagnosis. Similarly, patients who was visibly symptomatic, they were referred to the flu clinic. And if they were subjected to RT-PCR report, and if they were negative and the same thing was followed, they were sent to the OPD. And if the patients were having flu-like symptoms, they were positive, they were sent to the special COVID ward. Now, and then after once the patient was given entry into the college, all the individual departments, they had their own protocols, and following those protocols as per the government guidelines, their treatment was delivered. And mind you, our OPDs were just closed for a period of 2 weeks' time. From the start of April or mid of April throughout the pandemic time, it was a great achievement on our part as well as the medical college part. And after the treatment, few things which were there, which were to be taken care of, was the fallow period time, because we did not know anything about the virus being there in the atmosphere after the aerosol generating procedure, what we call as AGPs. So we came out with guidelines for ACH, for HVH people. We got in contact with the HVH personnel and asked them about fallow period time and what was the ACH of our institute. And we were told that since it's a closed environment, so we had that ACH of 2, and then the fallow period depending was devised on that. And after that, after AGP procedures, all the protocols regarding the, which were almost, which seem very routine now, are very new to all of us. The donning and doffing of the PPE kits, the availability of PPE kits, they were all very new to us, though they have become very normal now. And we also followed all the biomedical based procedures which were there. And as Dr. Reshnath Mehra said, that the health professionals of India, they have done a great job in providing the treatment, especially the dentist, especially perio, especially endo department, and of course the pedio department, Sumant, who provide treatment based on all treatment, maybe primarily or secondarily based on AGPs. We already say AGP to perform AGPs, and that was a time when we were very cautious about things. In fact, most of the faculty in our college was COVID positive. Some in the first, some the second, and now in the third wave, we daily get few faculty and the staff who are testing COVID positive. But we have taken it to our side, and finding that to be our duty, we are duties. And if anyone of the list of the audience wants to get a copy of our procedure, our document, COVID protocol documents, they can contact me. I think my number is the Sumant, which can be made public, and I'll be happy to share all our protocols in detail with all the audiences whosoever required. And ending with that, thank you, Sumant, for giving me this opportunity. And if there are any queries, I'm open to it for the discussion. Dr. Pankaj as well. He's actually joined in the nick of time. Over to you, Sumant, and thank you once again.
Thank you very much, Professor Kamarjit ji, for your extensive coverage and also telling about the protocols you followed during the challenging times. And now, hats off to all the corona warriors and all the healthcare workers. And we pray to Almighty for their safety and well-being. Also, our audiences. Thank you very much, and welcome, Professor Pankaj Goyal sir. He's now on screen, and he's the next speaker panelist. He's a professor of public health dentistry and head of the department AIMS Bhopal, and he's also ex-principal RIMS Ranchi. And I vividly remember during my college days when he used to teach us his favorite dialogue, rise and shine. So we used to rise and answer his questions. So always his cheerful makes up for the day. And thank you. We all welcome Professor Pankaj Goyal. The virtual podium, the virtual mic is yours. Over to you, Dr. Pankaj sir.
Thank you so much. Thank you so much, Dr. Sumant. And I welcome all the esteemed panelists. Most of them are very close friends as well. Professor Pravesh, Jeet Singh, and Professor Sanjay Saraf, along with Sumant, who's a very, very, very dear friend. And I congratulate Sumant, first of all, to you that you have taken this initiative in highlighting a very important and underreported, topic, which is the role of dental professionals during the COVID pandemic. So most of my learned colleagues have already, spoken about the various regulations which were formulated and the excellent work which they have done. I would just very quickly like to talk about some real life experiences which I had here at AIMS in Bhopal, and also the reports I was getting from my previous institute at Ranchi. So these are just some things I think we all relate to, and I would like to be a little explicit about them here. The first and foremost thing that comes to my mind is that when in late March 2020, the pandemic was declared, the first reaction of most of the dental professionals was a state of. It was not just the dental, and it naturally so, because not much was known about the pathogenesis of the disease. My team, specifically here, was really reluctant to actually go ahead and participate in any deliberation. I'll just turn my video off as my battery is low, but I'll continue to speak. So one of the first reactions which I found was that people were backing off and saying that, please don't post us in COVID ward, please don't post us. We are afraid, which was a very natural reaction, I believe. But a very strong support came in the form of the Dental Council of India letter, which encouraged all dental surgeons and paradental workforce to come forward and participate in countering this natural calamity. We don't know whether it's natural or man-made, but still we'll treat it as such. Then what that was a very to actually motivate my paramedical staff to go and participate in the fever clinic, wherein they were taking the samples, the nasal samples and the oral samples of these patients. And initially they were reluctant, but by the end of a year, they were so well trained, and most of them were so I should say used to it, that initial fear totally went away. And we would give them consultation in case it was desirable that the patients come to the hospital. We would invite them, and we segregated one single chair dental operatory for them, which was used for examining the patient, and in case any kind of a primary care needed to be done, we would get a screening and RT-PCR done for the patient, and in case the patient was not positive, we would perform the procedure. Obviously, we would avoid doing aerosol procedures. Mostly, we would limit it to pain control, and thereafter we would fumigate the operatory. But like I said, the patients trickled down to a very, very small, and obviously patients were also afraid. So the real challenge, I believe, in this process to actually get the personnel on board, the dental personnel who were afraid, they were feeling they did not have the requisite training or the requisite information of how to manage, COVID clinics or COVID wards. I think they really got boosted up once Q1 last year, just a year before, when the vaccination actually started. So that again helped the dental workforce to overcome their fears. So I think these were the kind of steps which really helped the dental personnel to volunteer, come forward. And I know of many cases, people who in individual capacity and conduct RT-PCR, swab collection, and examine the patient. So I think that was a time when dental workforce joined, hands to hand with the medical fraternity, prove that yes, oral health is inseparable from general health. The oral manifestations of COVID among patients, and interestingly, we found that in some of the patients who had no systemic symptoms of COVID, but reported because they were the primary or the secondary contact of COVID. This was interesting because they had no systemic symptoms. Obviously, it was a very small number of patients who came with such symptoms or oral manifestations. Majority of the people who did come had both systemic and oral manifestations. So these were some of the common symptoms we found. But interestingly, like I said, some did not have anything systemically, but it manifested orally. So we used that opportunity to conduct some research in addition to participating and providing primary care. And like I said, when the system comes together to support you in the form of the institute, in the form of the medical fraternity, in the form of the government, the dental council, I think that was the real litmus test. We majorly passed. Although I'm sure that there are several sad stories also where we have lost near and dear ones, and even dental surgeons, we have lost some very close acquaintances, very close friends we have lost to this deadly disease. So that was unfortunate part. Most practices had to close down, and they suffered terribly during this period. The expenditures went up, and the patients had to obviously bear the cost in the form of the precautions, the additional precautions which had to be taken in examining patients. So these were obviously the setbacks which patients and the dental fraternity had to face. But support by the government in the form of including the dental establishments under the MSME, the micro, small and medium industries, and facilitating loans, to overcome the period of, I should say, loss of revenue. But some of the, encouraging steps. So like I said, all in all, it was a mixed bag, but definitely with the support, we have been able to, put in the best foot forward and help, in a national cause. And I just hope that this new variant Omicron does not turn out to be so serious, and eventually, the pandemic, comes down to a level of endemic and with not so serious side effects. So thank you so much, esteemed panelist and Sumant. Thank you so much.
Thank you very much, Professor Pankaj, for your extensive coverage and also depicting the role of collaboration of various faculty members, the management, and all those public healthcare workers. And heartfelt condolences to those whom we lost during these challenging times. Now we quickly move to our final eminent panelist here, who is showing molar to molar smile, Professor Sanjay Sarafji. Professor Sanjay Sarafji is he's a professor of oral pathology, teaching at Oman Dental College, Muscat, Oman. And he is a very dynamic personality, very down-to-earth personality. Let us hear from him. Over to you, Professor Sanjay ji.
Thanks, Dr. Sumant, for inviting for such a nice discussion. And I really appreciate the rest of the panelists, the clinicians who have really faced a lot of challenge during COVID times, and they have done undaunting and a very nice task by countering the COVID pandemic and adjusting themselves to the different lifestyles and their clinical work. I'm an academician, and I'll be talking mostly about how my education system got affected by the COVID pandemic. I teach in Oman Dental College, Muscat, and all the aspects of life got affected, and so did the education also got affected equally. I'll just, because of the paucity of the time, well, fortunately, education in our institute did not get that much affected because I remember the COVID first case was reported in Muscat on 24th of Feb 2020, and there were some Iran travelers from Iran who came to Muscat, and then the whole thing started. And then we went into a lockdown. Our institute also was closed for some days, but then we started the online teaching sessions, and that was a very commendable job from our college. We got a very good support. We had already a virtual learning environment software, and we found out that our learning and the software was so nice. Education did not get the timetable, and then the students were accessible to all those changes, and they were informed. All the social media were used to interact with the students. So it was not at all much of a drawback or a setback for education in our institute. We also used the Microsoft Teams for teaching, And for assessment, one interesting aspect of Teams, what we did is, it's called as a whiteboard teaching. It's a whiteboard VAMR also. And what we did is it's an interactive board, learning board. Like as rest of my friends, my panelists know that I'm an oral pathologist, like we had to draw some diagrams. So on that whiteboard, I used to sort of draw some diagrams, and the students also could edit those diagrams. It's a virtual learning, more of virtual learning. The morphology of the teeth, they could rotate their teeth also. Even the students also could, play around with the diagrams. At the same time, we had a very good system of then assessment. We assessed their knowledge. We had an open book assessment. We had even the single best answers, and even the written part also was done on the years. We did this kind of teaching in our college. See, that's all. Thanks a lot, Dr. Sumant, once again, and for giving me some time to express my experiences as a teacher during COVID pandemic. It has affected all the aspects of life. Yes.
Academicians' view after having listened to Oman Dental College, the academicians' perspective and the way they devise new things, new Sridhargar Dental Center, we had a trial system. From the beginning, when the patient comes, enters the center, there is a place where the temperature is taken, and then from there they will be segregated. If high temperature, investigation for the investigations. If they have in the normal range, then they will be sent to the reception, and where there is an interface between the patients and the professionals. Let's say there was like barrier between the patients and the receptionists, and even in the waiting areas, there was seats which were blocked. So there was basically for social distancing in the waiting areas, and we tried to minimize the waiting time for the patients, and also ask the kind of them to wait outside in the car, and then their turn comes, they can be entered. And inside our clinics, even in the waiting areas and inside our clinics as well, those magazines or playing areas for the kids, those things for them to play, and the magazines or all those little were minimal. But most of the things which were placed there were informative visuals and all the things, as Professor Kawati sir mentioned earlier. And in the beginning, it was basically the emergency treatments like abscess extractions, and later on, when the severity declined, then we started opening up slowly, so in phase wise. But we have evolved over a period of time. We have learned to learn with this virus. Now we are on a different platform. Talking about India, from one lab, from being importers of face masks, PPE kits. Now we are the exporters of face masks, PPE kits, many equipments. So we should be proud, and proud of our vaccinations, or of our scientists, fraternity, policy makers, the government, and all the healthcare workers, corona warriors. So hats off to them, all of them. Salutations. Final words from our panelists. How would you like to send messages to our audiences, please? Professor Kamalji sir, Professor Sanjay Saraf sir, Professor Ramesh Mehra sir. Yes, sir.
I would like to say that since we all have evolved along with the virus, as I said in the beginning also, and of course all the ways in which you said in your comments are being called more or less in spirit, similarly maybe plus minus 1 or 2 points give and take here and there. Now that we have tried to live with the virus, encounter this, face it head on, it gives us a certain amount of confidence deal with this all on an institutional level as well as individual devise our own strategies. As our bodies have devised strategies to fight the virus, we have physically also devised strategies like you said that maybe in a hospital, the kind of luxury that we can probably because the same mandate so many chairs in our dental colleges, so we have lot many chairs. So that way we have that luxury that we usually leave 2 chairs, dental chair units, and then we adhere one before time. Of course, we all have done that, and suggest also said that he had to improvise not much, though he had to improvise over this teaching. That's what we started doing here. In a very short period of time, or is to develop all those infrastructures required for e-classes. Exam, PG exams even were held on e-basis. One of the examiner was a distant examiner, and one the external examiner was here. So, in fact, we have now started to learn to live with the virus and fight it well. And I think you all are doing that. You being a person who's so socially active are doing it at your level, we at our level, we are doing it. Everyone at his or her level is doing the same. I hope that this virus pandemic ends soon, and we go back to our old days, as Dr. Sanjay Saraf must be reminiscing. And again, thank you. And anything to add from my side or anything from my institute, we are always there. So thank you so much again.
Thank you very much, Professor Kamaljeet Singh ji. And final messages from Professor Pravesh Mehra sir, Professor Sanjay Saraf sir.
But I like to say that please don't lay off the guard. Please maintain social distance and wear the mask always. And don't take the latest so very lightly. I think we tend to do that. And believe me that this virus will also go one day. But what we need to do, maybe that we may be requiring booster doses after every 6 months, every year. We'll have to get the vaccination done. And a time will come when it will be endemic, or there might be just a few cases that might sometimes flare up. And we'll be living with this virus not more than 5 years. So 5 years down the lane, after that 5 years, we forget it. Just like the way we forgot smallpox.
Thank you very much. Thank you. Over to you, Professor Pravesh Mehra ji. Now your comments or advices for our audience.
We've learned the first thing that the social distancing is not required actually. The physical distancing should be the word.
Yeah.
You require physical distancing and be socially active. And especially provide support to your near and dear ones, whoever they are, in whatever times of need or whatever. So that is the first thing. And second thing, with the vaccination being there in all countries, I think in Kuwait also would be there, in Oman, in India also, we've got roughly around 50 to 60% of the population vaccinated. So that's a good step, and that's the only weapon that we have in hand against the virus, any viral infection. So we should get vaccinated, and ultimately, what the history tells us, the virus will ultimately die out. But yes, it has left some places in our practices. So our practices would change. There's a new normal now. Whatever normal was there, say 2 years back, that normal has changed. If you remember, I don't know, you were there, Sumant, or no, but I think Bhavajit, Sanjay, and Pankaj would be agreeing with that. We had the HIV and P there, roughly around 90s, 96, it was 92, 92 must be, 1992 that time. And we even wear gloves for our procedures. We never used to use disposable syringe and needle, it was boiled syringe. So these days, with the practices there, it's changed totally. So this is a new normal into it. And ultimately, we will and we shall. That should be the slogan there. So, Sumant, once again, thank you to you and to the league there. And that's the message we want to convey to everybody, that we will one day win over this battle, and we should win over this battle. We will, we can do it. Yes. Thank you. Thank you.
Excellent. So thank you very much, all those esteemed panelists here, present here. Unfortunately, we lost again due to some links, due to some technical issues. We have not been able to access Professor Pankaj sir, but we are happy and privileged to have Professor Pravesh Mehra ji, Professor sir. And we will be in touch once again. And for the time being, no to fake news, no to panic, yes to preparation. And media personnel, it should be not sensational, it should be sensible news. Thank you very much. We shall win, as Professor Pravesh ji told us. Okay, take care, stay blessed.